Chapter 011, Rant on Prescription Drugs. Tell your local doctor you're stressed out and you're likely to walk out with a prescription for Xanax or a similar benzodiazepine. Complain about ADD or depression and you may get a script for Adderall or Zoloft. You would think a general practitioner or GP would refer you to a psychiatrist for such a thing. But they are authorized and some are all too eager to prescribe you a drug used for psychiatric issues. You don't go to a psychiatrist for a cold or flu, and you shouldn't go to a GP for mental or emotional issues. Many psychiatrists, but not all, are barely more than walking, talking prescription pads. Your average psych appointment is an abbreviated 20 minutes of duration, ending with a script and a $300 invoice. If you've got insurance, which most people who see psychiatrists do, the cost is A-OK with you. Many plans will only cover an MD or PhD for your mental or emotional issues, making the psych industry strong and lucrative. Don't misunderstand me. Many people do indeed suffer from chronic and acute conditions of anxiety and other detriments that truly require benzo scripts, amphetamines, and antidepressants. Unfortunately, the medicating community is not very scrutinizing and far too lax in their evaluating processes to determine script necessities. ADD and bipolarity are two of the most diagnosed disorders in the medical industry. I am fairly conservative regarding diagnosis and have personally found that 3 out of 5 people I've met with these diagnoses barely qualify. When I read the DSM-5 diagnosis of their ailments to them, most clients exclaim, "Whoa, I don't have that." They typically present a few of the symptoms in a mild manner but do not meet the actual diagnosis criteria for full diagnosis. It's a boys' club. Insurance rarely will validate anyone other than a psychiatrist or psychologist as a qualified professional for mental or emotional issues. For drug recovery, they typically approve the larger corporate rehabs. If you want someone like a life coach who might work his ass off for you, you better dig into your pocket. Don't get me wrong, due to the legal requirements to be a legal life coach, there is none. There is a lot of untalented coaches out there who reinforce the idea that the MD, PhD industry is the only one viable. I wouldn't hold my breath on this culture changing soon, so do your homework and choose a professional wisely. Scrutinize your helping professionals, no matter what their credentials. It's a nice relationship. Insurance forces you into the offices of some of these lackluster professionals who collect fat checks for their years in school. I once sat in a psychiatrist's office with a client needing a prescription I was not licensed to write for him myself. After a 10-minute consultation with us, she reached for the script pad. I asked her, "Could you examine the issue more carefully to rule out alternatives to meds first?" My inquiry must have threatened her self-esteem. She yelled at me, "You need me!" She wouldn't last a minute in my office, actually having to listen and work with people. I actually need to keep my head, be cool, and treat people with sensitivity and respect, no matter what they are, or who they are, or what they say. My job is to serve others, and I recognize that when they see me, they're probably not at their best. I also know that as an alternative professional, insurance companies are not driving clients to my door and making me rich without having to be good at my job and market myself. In a perfect world, health professionals should require patients to participate in a cognitive improvement program to gain access to meds. In a merely sensible world, a person complaining of high stress, anxiety, panic, or depression who's requesting medication would be required to participate in a program that teaches him or her how to work on managing his or her issues. Proof of enrollment with a qualified therapist or life coach who is teaching the person to eat properly, sleep better, reduce the issues that are causing presented symptoms, exercise to increase endorphins, use a proper vitamin supplement regimen, and learn to meditate or use some form of relaxation process would be required. Let's go one step further. Let's make lazy scriptwriters be the therapist or life coach to their patients. You want to write scripts? You got to actually talk to your patients for more than 15 minutes at a stretch and give him or her real advice. We need to rethink our helping professional hierarchy. I didn't require 6 years of school to learn pharmacology. I learned it extensively in my drug counselor training and on my own in a short time. I know it sounds really simplistic and insulting, but I am dead serious. All you need is an above average intelligence, a stack of brochures, and a Google Chrome search engine to gain most of the knowledge you need about pharmaceuticals. Anyone can write a script, but it takes real talent and hard work to get to know someone and start solving his or her problems in a meaningful, sensible, strategic way. To allow that person to call you at night for advice and text you while you're on vacation to work through a problem. So let's put the scriptwriters at the bottom of the pay scale, and let's put the hour-plus session providers who put in the hard work at the top. Let's get a better measuring scale than the school your degree came from. Let's start gauging results and ask the people what they think of us. In our current model, pills are prescribed with less warning and literature attached to the bottle than I see on my bottle of Advil for my headaches. I've walked out of doctor visits with no advice or warnings on the high risk of abuse, dependence, dangers of withdrawal, or any handy info that could prevent harm. After a surgery, my ortho said he'd give me some Vicodin for the pain. I told him, forget it, I would need to take 5 of them just to feel it. He quickly agreed to Norco, 12 weeks worth. Within 3 weeks, I was skipping a day or two so I could stock up and overuse them to the tune of 10 a day at the end of the week. No warning, no advice, just the pills. And this guy is actually a good doctor. I was never even asked if I had an addiction issue. My partner and I desired a small benzo prescription to endure a 16-hour flight to India. She made an appointment with an MD she'd never met before, complained about stress, and in 15 minutes was given a script for benzos. Her time in the waiting room was longer than the doctor visit. My own estimation is that easily half of the amount of Xanax, generic name Alprazolam, produced by Pfizer is being abused. Doing some basic research, I found it very difficult to get any real numbers on gross sales or distribution of these drugs. My conspiratorial mind says Big Pharma has spent big money bearing the incriminating data. One stat says there are more script drug abusers than abusers of heroin, hallucinogens, and cocaine abusers combined. Prescription opiate overdose deaths outnumbered cocaine and heroin deaths combined. Total number of opiate prescriptions in the United States in 1991, 76 million. In 2010, 210 million. Total number of stimulant prescriptions in the United States in 1991, 4 million. In 2010, 45 million. It's documented that 53 million people abuse prescription meds. This equals about 1/5 of each and every written prescription. 1 out of every 5 pills prescribed in the United States is being misused. Think the government gives a crap about you or your kids? Think again. Your congressperson thinks way more of the luxury boat the big pharma lobbies hooked him or her up with than if your kid's dead in a ditch or in the ER foaming at the mouth. The political agenda is to make an impression of moral fortitude, protecting families. Look at the actual evidence to see what is really motivating them. But before we judge them, let's be honest about it and admit we would likely be seduced by similar circumstances. I mean, we are the public looking for these meds in the first place. If I get 4 points on my driver's license through minor driving infractions, my driver's license is revoked. There is no lag time. Once the record of any traffic convictions hits the DMV and they calculate the points over 4, I get a letter of notice and bam, I can't drive. Back when I had to make child support payments, if I was late or missed my support payment, my driver's license and my contractor's business license were suspended by the end of the week. It was that quick. Please don't tell me we can't organize enough to regulate and do more to keep dangerous drugs in check. 1, it starts on the clinical level. The doctors who write the scripts need to be less pro-script. Many, but not all, modern-day psychiatrists make bank writing scripts and nothing else. They are not discouraged by doing this and have quite a different incentive. Involvement and intervention is the key. Making the patient accountable for taking cognitive action is a start. Being a doctor who primarily treats people rather than medicating them. Mostly, we're talking about amphetamines and benzos here. Very few of the SSRIs and other mood regulators are abused, but the abuse levels of the first 2 are off the charts. So what about pain meds? In the US, legislation was passed making most pain meds prescribed through a pain management clinic or doctor only. We literally have legalized drug dealers now. 2, pain management clinics need to be more thorough with their patients and have more regulated control over the meds they prescribe. The main problem is the massive number of these drugs leaking onto the street as people under 25 are taking them from the med cabinet and using, abusing, trading, and selling them. If they're being heisted from the home medicine cabinet by Junior, you shouldn't be able to refill your script. Then there's doctor shopping, going from one doctor to another and doubling up on your meds by visiting multiple clinics for one ailment on the same prescription. At some point, we will have a digitized clinic community, making doctor shopping much harder. You go to one, and when you go to another, your name is in the system, and it shows your script history. Abusing this system should get you banned from Scrips. This system is in the very slow beginning stages, But it seems obvious that the same government that can create policies that revoke my business or driver's license within a few days could make this happen in a minute and do it nationwide, rather than the very small and few communities that have these policies. It's about priorities. And now the shady doctors. The girl described in the upcoming benzo chapter was getting her meds from a shady doctor in Studio City near LA. She was getting 100 Xanax a month. When she ran out early, which she did regularly, he would wag his finger at her and say, now, and write her a script for more. He also provided her with copious amounts of OxyContin, Ambien, and a few others I can't even remember. She was terrified that his prolific script writing was going to get him arrested. It wasn't compassion. She hated the guy for keeping her hooked, but she was terrified. If he got shut down, she would not be able to re-up her meds, and she'd go into such severe withdrawal that she would die from it. Using 8 to 14 milligrams of Xanax a day, I agreed she was at high risk. How's this guy not being looked at and regulated? Hopefully, one day, we will not only have a digitized database for patients, but also for doctors, keeping everyone honest. I'm too cynical to be naive, so here's the plain truth. It's up to us. Keep your meds locked up. Start working on making yourself the best you can be mentally and physically. Strengthen your kids mentally and physically. Only use prescribed meds as a last resort, not a first response. Remember that less is more. Low dose, infrequent use. Improve med quality. Most drugs for depression, anxiety, and bipolarity are not worth the little plastic capsule they come in. Always work with a qualified coach on your issues instead of or in conjunction with your meds. Anytime you can safely avoid a doctor's office, do it. Anytime you can safely avoid a pharmacy, that's a good thing. Check out the documentary, Dark Side of a Pill, a shocking, thorough expose into the pharmaceutical industry. KCET tagline, 1 in 10 adults in the Western world takes antidepressants. With global sales of approximately $20 billion, the prescription drug is one of the most lucrative products in the medical industry. Antidepressants are sold as a strong tool to bring tranquility to a troubled brain. But could there be a link between taking prescription drugs and resorting to violence? You've got options. Don't always look for the easy way, and don't drink the big pharma Kool-Aid. The idea that a little wonder pill can make you happy, social, normal, or anything else. There are no wonder pills, only pills that do wonders when they are used sparingly and in conjunction with your hard work.